Hello, good evening. My name is Min-Sung Kim. I was born in Hamburg. I was an entrepreneur by myself, and now I work at XLHEALTH since 2013. I'm leading the analyst team there. We've seen 2,200 digital. We've seen 2,200 digital health startups so far. We've made 5 investments. Our ticket range are between 500K and 5 million euros. Our latest investment that we made public was Medoc. It was a Finnish company similar to Teladoc, 3.5 million. And I'll be guiding you through the next 30 minutes. We have exciting guests here up in the panel. But let me first introduce Dr. Johannes Jacubeit. Give him a warm welcome. Dr. Jacubeit was a doctor before joining the entrepreneurial community. He was in orthopedic surgery and sports medicine, and he founded his company, I think, at the end of 2014, right?
Yes.
Yes, and I heard also that you like to code.
Oh yeah, I do. I've worked as a doctor and I've written code, so I combine digital and health, if you so want.
Thank you very much for joining. The next guest is Dr. Florian Weiß. He is the CEO of Jameda. Jameda is the largest doctor booking platform in Germany and just got acquired this year. Congratulations. Before joining Jameda, he worked at the M&A strategy department of Tomorrow Focus and was working with BCG as a management consultant. How are you after the exit?
Fine, thank you very much. Happy to be here. I think we have some interesting stories to share with all the other panelists, and happy to exchange ideas today. Thank you.
Last but not least, Mr. Max Müller. He is the Chief Strategy Officer of DocMorris. Before joining DocMorris, he was the head of external affairs of Silesia AG, and he has over 15 years of experience in national and EU healthcare. So thank you very much for joining us.
Thank you for having me.
So, gentlemen, how I understood, we are here to talk about game-changing in healthcare. Why are we talking about this right now, today, and not 5 or 10 years ago? What do you think, Mr. Jacubeit?
Okay. First of all, I think that 3 things have changed in the last couple of years. First, sensors. So we see sensors becoming very cheap, and we get, secondly, consumer awareness. So people tend to acquire knowledge about their health. They Google their health, they Google their symptoms, so there's a general interest in health. And on the other hand, we see more and more investment. It's becoming cool in digital health. So overall, there's a huge awareness gain during the last years.
Okay. And in the consumer space, you're obviously there too. How do you see the trend?
Well, what we see at Jameda is that basically the need for transparency in health is increasing. And I think why we're talking about this today and not 5 or 10 years ago is because now technology is at a stage where we can actually deliver transparency and fulfill needs that consumers had or patients had for maybe the last 5, 10, 15 years. But 10 years ago, it was not possible to actually fulfill those needs because we were only talking about the large industry giants like Siemens who were maybe trying to build up an electronic health record. But the technology was not so far spread that even smaller startups could actually jump into place and fulfill those needs. And what we see now is something like a grassroots development that many, many startups are picking up and looking directly at the needs of patients and fulfilling those, because now even a small startup like yours or like ours has the chance to actually build something that's changing the way we're looking at healthcare, and that's increasing transparency. And that's more or less what we are doing at Jameda, because we're not only a booking platform, but you'll find all the different doctors in Germany at our platform. 5.5 million patients come to our site because there's a need for transparency. People want to know not only what the doctor looks like, but how he's actually doing his job and what the quality of his treatments are. And I think 10 years ago this had just not been possible. Now it is. And it's a question of customer needs, I think, that can now be fulfilled.
Mr. Müller, you are the most senior guy here at our table. 15 years, so you can basically tell us what has changed so far. Why do we have a panel here right now?
Well, I think one of the main issues is, of course, technology has changed. I think the development of a device from Cupertino probably has been a driver to make it more user-friendly. But I think the second part is that when the new economy started, there were a lot of, let's say, typical retail consumer-oriented game changers in the business. Now, when we talk about healthcare and we talk about the tools or the platforms that we are providing, these are tools to support. But they will never put the situation in place that a physician, a hospital, or a pharmacist will be replaced just exclusively through technology. You always will have a mixture between offline and online. And I think this development started to get some insecurities within the professionals on how to use technology and not being afraid of it. Sometimes I do compare it to the 1850s, when in Manchester technology started. It scares people. Something they do not know, they do not understand, scares them off. I think this part has been overcome nowadays, and this makes transparency, patient empowerment, use of big data easier to understand and apply into B2B and B2C businesses.
When it comes to, I mean, we talked about consumer empowerment. We talk about the need for transparency. I think what enhances or what inhibits transparency is also data. I think since we are a VC fund, we always look at the business model, and most of the startups, they come up as like, we have data. There might be also like this economic interest in data, but at the same time you have this privacy issue. How do you deal with it with your startup, for instance?
Yeah, so what we do is we have an encrypted container for health data on the smartphone of a patient. For doctors, we have a plug-and-play hardware to exchange data directly with the smartphone, and we are not using the internet, and we as a company, we don't have data.
But this is where there is economic interest.
Economic interest, yes, but also as a company we have to make sure that our patients, and we work for the patient, they are in control of their data. So what we are aiming for is if a patient wants to share the data with whatever platform comes up, analytics platform, the patient is able to share it with an opt-in, and then the data can be monetized. But passively monetizing patient data is something that is very critical in my opinion. So we are dealing with it. The patient is in control of it. The patient has everything in his hand, and from there the patient decides where to distribute the data.
I mean, you sold your company Jameda to Border Digital, and I mean, did your data that you aggregated over the years, does it have any influence to your evaluation?
No, I don't think that data has been such an issue for us. I think we're not really selling data, and we're not collecting too much data. But what I think, maybe a little in addition to what Johannes just said, I think that data security and privacy is an extremely important issue. But there's another side to it, that actually consumers are willing to share data once they see a benefit in it. And that's what sometimes still surprises me in our internet economy today, is that you probably know that whenever you install an app and you're asked by that app, are you willing to share your contacts or your calendar? And of course the spontaneous reaction is no. But you are never actually educated why it should be of any value to you to share your contacts or your calendar, because there might be a strong feature for you that you like. And I think that's the same in healthcare. People and patients are actually willing to share data once they see their personal benefit in it and then see that it actually makes a difference to them. And when you are able to allow the consumer to decide who he's going to share data with, then he's much more willing to do it because he sees a benefit in it. And I think that's the one part of it, so educating patients about the value they get from sharing data. And the other side, from my experience, is that it's also a matter of regulation, because it's always interesting if it's an app or website, whenever you are asked to actually accept privacy regulations or privacy statement, data security statement, you usually have 24 pages, and at the end it's I accept. Nobody actually reads it because it's not standardized. You don't understand the privacy statement, so at the end you just accept it because you want to go on with the software or with the service provided. And I think that's another issue where we just have to get better, make it less complex, and have some kind of regulation where privacy statement looks the same across companies, and me as a consumer I can actually understand what's going on and what I'm going to share.
How I understand is that regulation is a heavy topic in digital health as well. I mean, Mr. Müller, do you have any experience to share with us with DocMorris?
Well, quite a few, but I think, just let me state one sentence in advance. I think we are having a typical European or specific German discussion about data security and data protection while talking about game changing in healthcare. Yes, of course, you're absolutely right once it seems the benefit, but you start every discussion, every panel I go to, there is this, yes, of course, this is very important, yes, but this is what the market's going to clear off. If you do not follow the rules on data privacy and data protection, consumers will never accept you. And then you run out of the market. First part. Second part, I can only encourage every startup company, especially if you work in Europe, put in your business plan a great bucket of money for a good lawyer. And make it clear right from the start. Because unfortunately, such a conference like today is of course great to see how great Berlin is as a city for startups when it comes political wise. And trying to make some positive PR of it. The fact of the matter is that regulation is too slow, is not innovative, and is not business friendly. This does not have to be that way, but unfortunately it is. Game changing in healthcare, when it comes to pharmacists, online pharmacies, as we do, were done by courts, not by politicians, not by regulators. I'm afraid to say that I don't think that is the right path to do it. But obviously, we come back to the question of trust and how far should I go? There are a lot of remote areas that could have an impact, and I do believe that through technology and the patient empowerment and the willingness of the individuals to say, I want to make my choices. Yes, I do know that if I share my data with whomever it's standing here, it comes at a price. Of course it is. But if the benefit is superior to the price, they will accept it. And the last sentence I would say is, we haven't even started to understand the value of data in healthcare. I think everybody is looking for the silver bullet here. We are starting this process very, very slowly. As we have seen this morning, I think it was by KPMG, healthcare when it comes to the use of data is way, way behind.
And that's why we have to be also very careful, but you also said like lawyer up basically to the entrepreneurs. I mean, there are some entrepreneurs I think in the audience. Is there any advice, other advice than to lawyer up?
Well, I mean, at the end of the day, it is important. You will make mistakes, and that is fine. But if you make mistakes, make big mistakes. And never be encouraged if you are running into a wall. Try to jump over it, run around it, never give up. It is sometimes painful, and it is sometimes an attitude that if you fail, you feel bad. But nevertheless, every new or disruptive model, whether it's in healthcare or in any other business, will create criticism, and they will try to, because of misunderstanding, that we live in a competitive world where there is enough for all of us, you should really stick to your game plan. And once you do that, and if you have a good model, then you will definitely be successful. And one last thing, and I think we are running a bit again into this area at the end of the new economy. If you are building a startup just to sell it expensively after the first round of monetization, I think you're not an entrepreneur, and I think that is the wrong path in order to create something great. Because there's nothing more fun than building up a company.
I mean, Dr. Weiß, what was your biggest mistake, if you failed?
That's hard to say. Well, maybe if I'm allowed to, I would start slide with a different issue, and that's maybe another advice close to what Max just said. It's an advice maybe that we could give, or at Jameda, to other startups in healthcare, because I think as long as you really focus on patients' needs, you will be successful, and I think regulation will follow. It is justifiably a highly regulated market, and that's good because healthcare is something that needs to be protected and regulated. But as long as you actually focus on what the patient wants, we are absolutely convinced that you will succeed and regulation will follow. Politics are a little slow, you just said it. Usually the innovations are not really driven in Germany by politics, but more or less by the courts. That's a pity, but it is still, I think, very true for today. But what we've seen with our platform when we started, we were actually the first platform that was bringing transparency into the sphere of healthcare and doctors. And there was outrageous reactions from the doctors, also from the associations, from the politics as well. And we had a lot of court suits as well. But at the end, we always won, and that's not because we are so great, because everybody could understand that there's a need for it. And patients are actually better off once there's transparency, and the whole market will get more efficient. And it's interesting that for every other industry, it's absolutely normal to have a feedback culture, to have something that regulates actually quality in a market, because customers can know what this company is delivering in a point of, from a perspective of service or quality. But in healthcare, this was not possible. It's very hard to measure outcomes of doctors, and we were the first one who were actually introducing that. So what I'm saying is, just start it. Don't be afraid by regulation, because once you're focusing on a patient need, and once you're actually focusing on making the market more transparent and more efficient, I'm pretty much convinced that regulation will follow. What do you think?
Well, I think I'm not in the position yet to give advice. But I would like to raise awareness for something that is very important right now. As a doctor, the last century, a patient came to me and I had the responsibility to discuss with the patient what the next steps could be based on the things I've learned. So responsibilities were between doctors and patients. What's happening now when I, as a patient, get a diagnosis from code, the responsibilities are shifting from patients and doctors to entrepreneurs, investors, and software developers. And that is a heavy paradigm shift we're seeing here. And we need to take this responsibility and work with it and be aware of it. And that's something I would position as an advice, if I am allowed to.
And what do you expect from us investors?
Well, you have the responsibility to look if it's a business model which is okay ethically, which does not exploit humans, but creates value for society in general.
Mm-hmm. And speaking in general, what kind of challenges do you see in the next 5 to 10 years, Mr. Müller?
I think the biggest obstacle is that the ones who are actually leading the new ideas to be, on the one hand side, not to be superstitious and over-ambitious and trying to get all the stakeholders up and running with them. Because you will not work, if you go to a doctor and the doctor say, don't go to Jameda, don't go to DocMorris, don't go to Connected Health or wherever, they're a person of trust, and they will always be superior to any kind of technology, because healthcare is a question of trust. I think that regulation is important, but we should create an area in which things should be tried to be possible, because every regulation will be 3 to 5 years behind a technological development. And never forget, technology is always just a tool. We have 3 million patients with individual stories, individual problems, and we have to help them take care of their disease, whether it's a chronic disease or a non-chronic disease. And if you do not forget this, then I'm fully in agreement, then I think there is going to be a bright future ahead for game-changing processes in healthcare. And don't be afraid of using data, but do it sustainable, and do it with an ethics code. I think that is important.
Biggest challenges or obstacles?
Or maybe also opportunities. You know? I think we always talk about obstacles, but what about the upside?
Well, I think one big opportunity right now is that we are, as you said in the introduction, we are also Germany's biggest online appointment booking platform. And what we see is this is something that's immensely demanded by patients, to have transparency about what doctor in my vicinity actually has the next free available appointment, because I'm in need of seeing a doctor and I don't want to wait 3 weeks for it. And that's something that's kind of a paradigm shift, because it changes the way we're looking for a doctor. Because before I had maybe had 3 specialists that I was regularly seeing, and now I can look at my smartphone and see in this vicinity of 5 kilometers which of the doctors actually has the next free available appointment for me. And that's an opportunity for patients, but it's also a big challenge or obstacle, because doctors are of course reluctant to do that, because it changes the way they are doing business. And it brings them actually in a situation where they have to do business, because especially doctors in Germany are not actually regarding themselves as entrepreneurs or people who are doing business, which is good, because their mission should be to actually help people get healthy. But nevertheless, now they are starting to feel that they are in a competitive environment and that they need to react to patients' needs and regard themselves as a business. So that's also an obstacle, because it's a paradigm shift and doctors have to be willing to see that. But we've just done a big study this summer about digital health in Germany, a representative study showing that more than 80% of the German patients actually want to book their appointments online, but only about 20% have been able to do so in the past, because doctors are reluctant to offer that service, because they don't want to open their books to everybody and be transparent about it.
So why does healthcare become more personal? Like, why is there a paradigm shift to the consumer? Dr. Jacubeit.
Well, first of all, everything is more personal, everything is more in control. So we as humans, we have learned over the last years that we get a gratification if we have an informational need. We just get the information. If I need a doctor, I don't know what to do. I book an appointment now. So that is a main thing. Regarding the challenges and opportunities, I think the challenge is doctors. Doctors are reluctant to change. It worked. It worked the last 40 years.
And it works with you too, right? I mean,
well, yeah, but I went out because it doesn't work like this anymore. I mean, IT is not up to the standard we are used to in the consumer, and with smart devices and so on. So I was sitting there as a doctor, and I just couldn't work with the IT and paper, and patients didn't hand me over the information and so on. So that's the biggest challenge, in my opinion, to get doctors to change and see the benefit. And that's also the biggest opportunity if we get doctors to change. And the interfaces, and that's another thing. So the connectivity of all the devices that are coming up, from health devices like Apple Watch and so on. So if we get this connectivity through to the doctor without interrupting the workflow of doctors, then they will see the benefit. And that is one of the biggest opportunities I think we have, and especially we have as a company.
30 minutes are almost over, ladies and gentlemen. I'm sorry, I think this is a very interesting discussion here. To sum up, I think that we are in a state where technology is so advanced that it can provide the transparency between the two markets. Market sides, as well as giving the consumer more information, where the healthcare system shifting towards more a consumer-orientated market, as well the economic interest in data. We have to be, of course, we have to be very careful about data privacy, and there are many obstacles, but I think all these entrepreneurs here agree, as an entrepreneur you should just do it, and if it's something that serves the market, that serves the customer need, there will be a future. We will be opening up the floor for questions. Are there any questions? Yes, sir. Is there a microphone there? I think over there is a microphone.
Thanks a lot. Thank you for the valuable discussion. My name is Gerhard Dieterle. My wife is a pharmacist. And what I'm missing here in this discussion is the role of the Krankenkassen. I mean, if we talk about game-changing in healthcare, in fact, the Krankenkassen are dictating every day, every year, what can be done in healthcare services and what not. So the role distribution between patient on the one side, doctor on the other side, the third very important function is missing here in this discussion. And
what is the question, sir?
These are the organization of the Krankenkassen, let me say. So how do you see how this can be changed? How can we influence these organizations who pay the bill finally and dictate what the doctor can do and what the pharmacist can do?
Thank you very much.
It's already happening, if I may. I mean, especially speaking as a pharmacy. Also, again, transparency is one of the issues. Nowadays, you go on Facebook, you go on Twitter, and show your case to your friend area, and then it goes viral. Just one of the examples is this case of incontinence, where one major sick fund had an issue with that. It became public, it came into the media, and a lot of individuals, with all the individual story, went public. And so these small stones put together a picture, and now government and regulators have acted, and they will change regulation to a pass. I fully agree. Sometimes it is a problem, but sometimes we also have to take care of the fact that, again, these kind of changes take time. And if a patient has the choice of saying, if you are not willing to do something good for me, while you are looking after my money that I as an insured person are paying, then I'm going to someone different. And then I choose one of the other 129 sick funds. And again, this in the 21st century is just a question of time. Sometimes it is going too slowly, but it's going to change.
I mean, after all, we are the people who made the regulations, yeah? And the regulations are not like made us. So I think we have to always keep that in mind, but of course it will take a while. But thank you again for the question. Are there any other questions? Because our time is up now. Oh. Yeah. Yes, microphone is...
Great panel. I have 2 questions for you. So you are both like talking about these platforms which are actually connected to physicians, right? Well, one of the challenges in regulation is when you have platforms which are not owned by physicians or do not involve directly physicians, which actually means that in many countries like the United States, they are not actually subject to the same regulations, namely on privacy. So I was wondering whether this is something that you have thought about, and this is something whether you actually see these other platforms as competitors, because in the case of Johannes, he's clearly a doctor, so when he structured his business, he knew what he was doing, and he's of course subject to all these regulations. But someone else who is not a doctor will not be subject to the same regulations as he is. So this is something interesting to think about. And the other subject is, of course, the insurance companies, right? In many countries, like insurance companies are very interested in mobile health, but only if it is possible actually to prove that the treatments and the kind of services that you offer are evidence-based. So are you focused on evidence-based medicine, and how are you approaching this in terms of insurance?
Maybe starting with your second point, evidence-based medicine, I think that's a very interesting and highly important issue also here in Germany. We are far behind, I think, the States when it comes to pay-for-performance issues. Actually, pay a doctor or a hospital for healthcare outcomes and not just for the treatment. And we have the problem with the doctors that are actually outpatient, not in the hospital, that there are no outcome measures that are objectively across the country. So what we are doing in our platform right now is we're giving patients the opportunity to rate a doctor, write a review as specific as possible about his experience with the treatment. But we would be very happy to actually include objective measures of healthcare outcomes. Problem is there are none so far, especially with a focus on outpatient doctors in Germany. But yes, I completely agree, that will be the next step, because otherwise it will be very hard to distinguish the good doctor from the bad doctor, and it will be very difficult to allocate the money in the way that it's efficient for the system. So I would completely agree, that's the next step, and we would be more than happy to implement that on our website. I know that the politicians are actually working on that. There are some institutions that are trying to develop an index of healthcare outcome measurement, but it's still very, very early, and we don't see the development yet to be able to go broad into the market.
Do you have anything to add? Oh.
Yeah. If we look at medicine, I mean, we started evidence-based, right? There was a doctor, he knew the things. Now it's evidence-based. We kind of think that the stuff is right what we do, and we're going towards a time where it's data-driven. So software will tell us and strip data and tell us what we have and so on. So that is where we are heading, but it needs come from the patient side, and the patient needs to be willing to do so. Regarding the outcome, I think as soon as it becomes easy and seamless as a patient to hold your health in your hand, to literally have all the data and information, we can shift towards it, because then it's super simple to provide questionnaires regarding a specific symptom, feed this back to the doctor, feed this back to the hospital, and then we will acquire data that is beneficial for everyone.
Very briefly, patient-reported outcomes. Yes, this is what we do, because they can do a great job as the doctors, find the right diagnosis, prescribe the right medication. Manufacturers are doing a great job with innovative medication or with working generics. But the problem is, if the patient is not swallowing his pill and doesn't understand why he needs to do this on a constant basis, it's not going to work, and it's going to create higher costs. So this is at DocMorris what we do with over our 3 million patients. We have over 1.5 million chronically ill patients. And we've done studies from multiple sclerosis over Parkinson's to diabetes and whatever there is. And we can show, with the help of data and technology and our pharmacists and PTAs that we have, that if you have the right language and the right attitude towards the consumer, towards the patient, you can create patient-reported outcomes that show that together with doctors and technology and the understanding of the patient, and this is real patient empowerment and responsibility, that it's going to work. And I'm happy to give you more information afterwards.
I think, yeah, this is a long and ongoing discussion, which is also very important, but I think these gentlemen will stay here also after the break, and not to bore you, I will just finish this panel for now. Thank you very much for participating, and please applause to the panel.
Thank you.